Good morning.
Good morning.
The Senate Committee on Education and Health will come to order. And clerk, please call the roll.
Madam Chair, you have a quorum.
Thank you. So good morning again. We have 43 bills on the docket today, so it is going to be quite a bit of discussion around those bills. But again, we have addressed most of these bills in our subcommittees, so we will primarily be hearing subcommittee reports. There is one bill that's been recommitted to our committee, and we will start with that as well. But our subcommittee chairs will give a report on the bills that were heard. And members, at your seats, you'll see the packets containing any substitutes or any amendments that were adopted by each of the subcommittees. And every bill that went through a subcommittee process had the opportunity for public testimony. Some had very extensive public testimony. We will not be having any additional testimony on these bills today. We will hear from patrons if it's necessary, and if your bill received a unanimous positive recommendation from a subcommittee, your attendance is not required here today, but we will contact you if your bill hits any kind of a roadblock. But with that, let's get started. The bill that was recommitted to our Senate Education and Health Committee is SB 21, patroned by Senator Salim, and I believe that there is a substitute. Senator, if you would like to present your substitute, and do we have a motion on the floor?
Move the substitute. Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The substitute has been adopted. Senator Salim, if you'll present the substitute.
Thank you, Madam Chair. With the SB 21, we did a substitute to ensure that when it came to higher ed, when it came to the disability community and other stakeholders, we took it back and ensured that they had a say in all of this, along with ensuring that the process was more transparent. So what the substitute does is, instead of setting the guidelines as originally intended, what it's going to do is it's going to authorize State Council of Higher Ed for Virginia to consult with representatives from public institutions of higher education, students enrolled at public institutions of higher education disability accommodation professionals, and subject matter experts to be selected by the council to essentially do a study to understand that process of how someone gets their accommodation as a disability student and what that looks like. And that's essentially what this is doing. And it will be set that the study is conducted by October 1st so that we have plenty of time to review and take the recommendations from that council and the committee to ensure that we properly address this issue.
Thank you, Senator. And because this is a fairly important change that you're presenting to us, I will allow 5 minutes of discussion if anyone on each side, if anyone wishes to speak in support or in opposition to the substitute, we will allow that. If there are any questions from committee members as well, let's open it up to committee discussion. I see no one in queue to ask from the committee. Senator, do you have anyone who wishes to speak in support?
I think we found, as Senator Marsden would say, peace in the valley.
Okay. Well, very good then. The substitute is in front of us. Is there a motion on the floor?
Second.
It's been moved and seconded that we report SB 21. Clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 21 has been reported, and I don't believe it will go to finance. So I think we're in good shape. Thank you.
Thank you, Madam Chair. Thank you to the committee.
Thank you, Senator Salim. So our first subcommittee report will be from the Health Professions Subcommittee, chaired by Senator Boysko. Senator Boysko.
Thank you, Madam Chair. The first bill that we have was SB 331, the Patroness Stewart. We had a substitute. I so move. Substitute? Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition?
Madam Chair, this is the substitute changes the bill to a Section 1 bill instead of imposing certain informed consent requirements on physicians performing hysterectomies or oophorectomies, directing the Department of Health Professions in consultation with the Board of Medicine to review such existing informed consent requirements, making recommendations on the necessity of developing or adopting regulations of educational information provided as part of the informed consent process to patients prior to undergoing any such procedure. And I so move. Recommend passage.
It's been recommended that we report SB 331 with the substitute. Or is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 331 has been reported.
Thank you,
with
Madam.
substitute.
Madam Chair, SB 403 by Senator Durant also had a substitute, and I so move.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
The substitute has been adopted. Senator Boyska.
Thank you, Madam Chair. The substitute changes the term behavioral health aide to behavioral health technician and changes corresponding terms accordingly. The substitute also clarifies the qualifications, scope of practice, and supervision requirements for registered behavioral health technicians and registered behavioral health technician assistants, and established qualifications, scope of practice, supervision requirements for qualified mental health professionals and qualified mental health professional trainees. Finally, the substitute replaces the delayed effective date of July 1st, 2026 with a final enactment clause requiring the Board of Counseling to adopt the regulations pursuant to the bill to be effective November 1st, 2024. The substitute also, based on recommended amendments adopted in subcommittee, eliminates the definition of qualified mental health professional child and qualified mental health professional adult in conformity with the amendments that made to that definition by SB 155 by Senator Head. General Counsel.
Madam Chair.
I believe Senator Durant may want to offer changes to that substitute or another substitute.
Madam Chair, that's correct.
Senator Durant, do you want to present the substitute?
Yes, Madam Chair, would you like me to come forward or right here, okay? May I stay here, or would you like me to come? Okay.
Yes.
Thank you, Madam Chair. This amendment in the nature of a substitute reflects input from the Virginia Network of Private Providers and the Virginia Association of Community Services Boards. It's clarifying in nature. I promised I would incorporate their suggestions into friendly amendments after the Health Professions Subcommittee meeting last week. This substitute reflects those suggestions as well as some clarifying language that would keep that consistent throughout the bill. Added to the bill description behavior health technician assistant, which was not included, and defines collaborative services to describe the collaboration between licensed and non-licensed mental health workers, and further refines the definition of supervision under the scope of practices to ensure it is clear that supervisors may only supervise within their scope and area of board-defined competencies. And other edits in the substitute were made to ensure that there was consistency throughout the bill. I have agency representatives here if who are happy to speak if there's any questions on this clarifying language.
Thank you, Senator Durant. And just to clarify, this is new language. We adopted the substitute that the committee had presented, but this is a new substitute that we must adopt now.
Yes, Madam Chair.
Is there a motion to adopt the new substitute?
Second.
It's been moved and seconded that we adopt a new substitute. Senator Favola?
Question, Madam Chair. Since we adopted the earlier substitute, this could be in conflict with the earlier substitute, or could you please qualify that? Because we may have to reconsider our vote on the earlier substitute. That's my question.
Madam Chair, Senator Boysko, this was as promised, to give that clarifying language and make sure that we were clearly defining how the scope of supervision was going to be clarified. So I've got Dr. Plaska, who's the Senior Clinical Advisor with DBHDS, as well as Aaron Barrett, Virginia Department of Health Services, who can sort of expand on that clarifying language that was requested by.
No. Madam Chair?
Mine's more of a process question.
Yeah, Madam Chair, just question. It
Senator
was,
Head.
was this substitute drawn to the earlier substitute or to the originally introduced bill?
This is based on the Madam Chair, this is based on the substitute from the last meeting, the last subcommittee meeting.
And so, Madam Chair, I don't think there would be a conflict with the substitute that we just adopted. Then this would be changes to that substitute rather than the originally introduced bill. So.
Thank you, Senator Head. Sorry, I know, I was.
All in favor?
Aye.
The amendments to the substitute have been adopted. The substitute was previously adopted, so I think we are procedurally correct.
That's correct.
Is there any discussion on the amendments or the substitute that has been introduced? Senator Aird.
Madam Chair, I just have a question about the substitute and generally, and I know Senator Durant mentioned that someone from DBHDS is here.
Madam Chair, yes, that's correct.
Senator Aird, do you wish to hear from our expert witnesses?
Yes. Thank you so much. I just wanted to clarify whether or not the need for the scope and the clarifying definition for the behavioral health technician, this isn't new, but is this just to make sure were we having issues with them practicing beyond their scope previously? I just wanted to better understand.
Madam Chair, members of the subcommittee, this would be a new role, so they didn't have a scope defined before.
Thank you, Madam Chair.
Thank you, Senator Aird. Are there any other questions from the committee? Seeing none, is there a motion on SB 403?
Second.
It's been moved and seconded that we report as amended and the substitute.
The amended substitute.
The amended substitute. It's been moved and seconded that we report that bill, and clerk will open the roll.
Ruiz.
Ayes 15, no zero.
Thank you. SB 403 has been reported with the substitute as amended. And Senator Boyska.
Madam Chair, SB 553 is patroness Senator Hackworth. It has also a substitute, and I so move.
Second.
The substitute
The substitute has been moved and seconded. All in favor of the substitute?
Aye.
Aye. Any opposition? Thank you, Senator Boyska. Substitute's in front of us.
Thank you, Madam Chair. The substitute directs the Board of Nursing to amend its regulations to permit nursing education programs located within the designated area to contract for unlimited number of required clinical hours at out-of-state clinical sites. The bill is introduced, directs the Board of Nursing to amend its regulations to permit students in nursing education programs who live within the designated geographical areas to complete an unlimited number of required clinical hours at out-of-state clinics, such as if you were on the border of Virginia and Tennessee, they could go to Tennessee or West Virginia if that were the case. And I so move. It was recommended reporting 5 yes, 0 no with the substitute.
The recommendation is that we report as substituted. And is there a second?
Second.
Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 553 is reported with the substitute. Senator Boyska.
Thank you, Madam Chair. SB 614 is the patron is Senator Pillion. This also has a substitute, and I so move.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. This substitute changes the title of the code, being amended from the title on professions and occupations within the subtitle on professions and occupations regulated by the boards within the Department of Health Professions to the title of the code relating to crimes and offenses, making re-referral to the courts of justice appropriate. This adds xylane to the list of Schedule III drugs, and it was recommended 5 yes, 4-0 to be referred to finance.
To courts.
To courts and then to finance.
And then to finance.
It's going to be jumping all around.
It's never gonna get out of there.
It's been moved that SB 614 be reported with substitute and re-referred to courts and then re-referred to finance. It's a long journey ahead for this poor little bill. And is there a second?
Can you second?
It's been moved and seconded that we act as recommended. Clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 614 has been re-referred to courts of justice and to finance. And Senator Boysko.
Thank you, Madam Chair. SB 716 is patroned by Senator Carol Foy. It also has a substitute, and I so move.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. The substitute reduces the scope of the bill by eliminating sections created by the bill as introduced, regulating certain actions brought by the healthcare providers and law enforcement investigations relating to reproductive healthcare services and reproductive data. It was recommended reporting 3 with the substitute, 3 yeses and 2 nos, and I so move.
Is there a
I
second?
will second that motion.
It's been recommended that we report SB 716 with the substitute. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 9, no 6.
SB 716 has been reported with substitute. And Senator Boysko, I believe that concludes.
Madam Chair, that completes the report of the Senate Subcommittee on Health Professions. Thank you.
Thank you, Madam Chair. I am going to ask Senator Locke to present her report for higher education next.
Thank you, Madam Chair. Up first is Senate Bill 347 from Senator Reeves, and there is a substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The substitute is in front of us.
Initially, this was a legislation that would make changes to the Virginia Military Survivors and Dependents Education Program. The substitute changes the bill to a Section 1 bill directing the Secretary of Veterans and Defense Affairs in collaboration with the Secretary of Education to convene a stakeholder work group to evaluate and make recommendations on legislative actions and budgetary modifications that would improve the long-term viability of the Veterans, Military Survivors, and Dependents Education Program. And with that change, the committee recommended on a vote of 5-0 that this bill be reported, and I so move and re-refer it to Finance.
Second.
It's been moved and seconded that SB 347 be reported and re-referred to Finance. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 347 has been reported and re-referred to Finance. Senator Locke.
Senate Bill 418 from Senator Head had an amendment, and I move the amendment.
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposition? The amendments are in front of us.
As amended, Senate Bill 418 establishes the Virginia Museum of Transportation as a public entity and educational institution under the Commonwealth. The amendment added language providing for the staggering of terms for the governor's initial appointments to the Board of Trustees and changes from at least 7 to no more than 7 the number of members to which the board may appoint in establishing an executive committee. And with that, Madam Chair, the subcommittee recommended on a vote of 5-0 that this bill be reported, and I so move and re-refer it to Finance.
It's been moved that we report with amendments and re-refer to Finance SB 418. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 418 has been reported with amendment and re-refer to Finance. Senator Locke.
Thank you, Madam Chair. We then move to the substantive, long, extensive Survey docket. We begin with Senate Bill 501, and there was a substitute, and I move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us, and
Okay, Senate Bill 501 addresses the Virginia College Savings Plan and establishes the Virginia College Opportunity Endowment and Fund. This would direct the board of the Virginia College Savings Plan to deposit $250 million per year of surplus monies from the plan's fund into this new Virginia College Opportunity Fund established by the bill. The substitute makes several structural, technical, and substantive changes to the bill. The major changes include eliminating the requirement that the plan deposit this $250 million per year of surplus monies from the plan's fund to the Virginia College Opportunity Fund, replacing it with the requirement that in the fiscal year beginning January 1, 2024, $500 million be deposited from the plan's fund into the Virginia College Opportunity Fund and each year thereafter, requiring the College Opportunity Investment Advisory Committee submit to the chairman of the House Committee on Appropriations and the Senate Committee on Finance and Appropriations a report on the current surplus of funds to be used in the determination of subsequent transfers from the plan's fund to the Virginia College Opportunity Fund, and adding a requirement that 90% of all income in the fund be used for full scholarships, including room and board, to students attending eligible universities, and those universities are so named in the legislation, that the remaining 10% be used to support other programs that enhance educational access and affordability for students. This Senate Bill 501 received a extremely thorough vetting in the subcommittee. And on a vote of 5-0, the subcommittee recommended that Senate Bill 501 be reported and recommended to and re-referred to Finance, and I move that 501 be reported and re-referred to Finance.
it's been moved and seconded that we report SB 5.
As a substitute.
It's been moved and seconded that we report SB 501 with the substitute re-referred to Finance. I am going to open this up for more discussion. I think I see Senator Survey here, and he and I have not had an opportunity to speak this morning, but Senator Survey, are you presenting any amendments or substitutes to the substitute?
Ms. Bergamini prepared a sub that had a couple small edits that J-Lark requested. They're not, we can deal with that in Finance, or the higher ed sub in Finance, which is where this is probably going. The other draft that I exchanged with you isn't prepared for presentation to the committee, so I think we'd probably need to wait on that.
So your desire is to present that in the Finance, the redrafts and addressing some of the issues?
Yeah, I mean, they're actually more, well, some of the issues in the sub Ms. Bergamini prepared are probably more appropriate for the Finance Committee anyway, as opposed to the policy issues for this committee, but I think that's probably the way to go.
Okay. We have a motion in front of us. Are there any committee members who wish to speak? I'm just going to share my concerns with the legislation as it is, and Senator Surville, the patron, and I have been having conversations around it. I am concerned with the designation of eligible universities. The substitute does not include opportunities for community colleges, as we've discussed. I am concerned about the 8-year period in which students will be, or graduates will be tracked for their employment purposes. I'm concerned about the debt that any student might incur if they don't maintain full-time employment and have to repay this scholarship. I'm concerned especially about the students who are in vulnerable situations and may not be able to have full-time employment. So for this reason, with the substitute that's in front of us, I will be voting no on this, with the understanding that the patron and I will be continuing those conversations as the bill goes into finance.
Right.
Seeing no other discussion, clerk will open the roll.
Ayes 9, no 6.
Looks like a party line vote.
Thank you. Senator Surville, SB 509 is reported as 501 is reported with the substitute and re-referred to finance. Senator Locke.
The next bill is Senate Bill 506. I also had a substitute, and I moved the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
This was supposed to have been the easy one. Anyway, the substitute, this Senate Bill 506 addressed public institutions of higher education dealing with legal counsel, the scope of employment and duties and powers of governing boards, and the substitute adds to the bill a requirement that each public baccalaureate institution of higher education include in the membership of its governing board one non-voting advisory faculty representative to be chosen from the individuals elected by the faculty or the institution's faculty senate or its equivalent, and one non-voting advisory staff representative to be selected by the staff of such institution in the manner such staff members deem appropriate. The bill itself provides that the governing board of each public institution of higher education shall have the authority over the employment of all legal counsel for the institution, including decision-making authority in the commencement or termination of any legal counsel, the employment of outside legal counsel, the oversight and management of any legal counsel, and the appointment of a general counsel to serve as the chief legal officer of the institution. The bill clarifies the scope of the involvement of the AG in the legal affairs of public institutions of higher education, providing that the AG may only provide legal service to a public institution of higher education upon the request of the governing board of that institution or upon the governing board's decision to delegate all authority in accordance with the provisions of the bill. The bill permits the governing board of any public institution of higher education with less than 7,500 full-time students to delegate all authority over legal counsel conferred pursuant to the provisions of the bill, but requires any such governing board intending to make such delegation to submit notice of their intent by January 1, 2025, and thereafter to delegate such authority or to rescind a prior delegation of such authority to submit notice. Finally, the bill clarifies the duties of the governing board of each public institution of higher education in its collective capacity and of the members of such governing board in their individual capacities. After extensive conversation and the pros and cons of Senate Bill 506, the recommendation was to report on a vote of 3 yes and 2 no. And Madam Chair, I move that Senate Bill 506 be reported and re-referred to Senate Finance with the substitute.
Is there a second? It's been moved and seconded that SB 506 be reported with the substitute and re-referred to finance. Is there any discussion from our committee? Seeing none, clerk will open the roll.
Ayes 8, noes 7.
Thank you. SB 506 has been reported as with the substitute and re-referred to finance. Thank you, Senator Surville.
Thank you, Madam Chair.
Senator Locke.
Next bill is Senate Bill 678 from Senator Rowson. There is a substitute, and I move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Senate Bill 678 addresses intercollegiate athletics compensation and representation for name, image, or likeness. The substitute makes various technical changes throughout the bill, and it also adds language to clarify the provisions relating to the confidentiality of information disclosed to any institution of higher education relating to an individual student athlete or such student athlete's name, image, or likeness compensation. After much discussion regarding this particular piece of legislation, it was recommended by the committee that this bill be reported on a vote of 5-0. And Madam Chair, I move that Senate Bill 678 be reported and re-referred to Senate Finance.
Second.
With the substitute.
With the substitute.
It's been moved and seconded that we report with substitute and re-refer to finance SB 678. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 678 has been reported with the substitute and re-referred to finance, and Madam Chair is quite excited.
I am so excited.
You want some more?
Well, you all are going to be even more excited.
Senator Locke.
Okay, our final bill was Senate Bill 717 from Senator McDougal, addressing the duties of governing boards and acceptance and use of donations at public institutions of higher education. And this bill was recommended to be continued on a vote of 5-0 from the committee, and I move that Senate Bill 717 be continued.
It's been moved and seconded that SB 717 be continued. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 717 has been continued to 2025.
And that completes our docket.
Thank you, Senator Locke, for your committee's report. And with that, we'll go back to Senator Favola to report on the Health Subcommittee. That is on page 4.
Madam Chair, I draw your attention to Senate Bill 34. The patron was Senator Locke. And I first move that the committee adopt the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The substitute is in front of us.
Thank you, Madam Chair. So the substitute clarifies and expands the definition of a certified evaluator. This has to do with somebody who would be doing the evaluation and screening in an emergency department of an individual on a TDO. This is a pilot. One institution would be doing this, would be participating in this pilot. The conversation in the committee evolved around whether the CSB in the area should be the only entity doing the pre-screening. And the committee departed from that traditional approach to try this pilot. The substitute adds monthly reporting requirements for participating hospitals with psychiatric emergency departments in Planning District 21. After the conversation continued, the committee also decided to offer amendments to the substitute, and they are just amendments, and I so move that they be adopted.
Second.
It's been moved and seconded that we adopt the amendments offered by the subcommittee. All in favor?
Aye.
Any opposition? The amendments have been adopted.
Okay, thank you, Madam Chair. The substitute incorporates an amendment that adds a fourth enactment clause requiring the Department of Behavioral Health and Developmental Services to submit to the Senate Committee on Education and Health and the House Committee on Health and Human Services a evaluation. The pilot program established by the bill was set to expire July 1, 2026, and then a report on the overall effectiveness would be submitted thereafter. And on lines 28 through 31, the pre-screener orientation presentation that the bill requires, each evaluator must include information on determining the least restrictive treatment available. That is our current law. We just want to make sure that this new model with the hospital personnel doing the screening are trained and fully aware of the least restrictive approach. So I have, in essence, described the bill. I would ask if Senator Locke has anything in addition she would like to say.
You did an excellent job.
Thank you, Senator Locke. I do hope it is the wish of the committee to pass the bill. It reported out of our subcommittee 4-1, and it does have to be referred to finance, and that is my motion that we report the substitute as amended and re-refer to finance.
Second.
It's been moved and seconded that we report SB 34 with the substitute as amended. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
SB 34 has been reported with the substitute as amended and re-referred to finance. Senator Favola.
Thank you, Madam Chair. Next bill is Senate Bill 119, patroned with Senator Lucas. And this bill requires a drug manufacturer has a condition of obtaining a permit or a condition of registration or renewal to certify that it does not limit the number of contract pharmacies. This is an important point. We are talking about drug manufacturers who are manufacturing drugs under the federal 3040B, which would be drugs that are going to our community, federally qualified community health centers. So what this bill essentially says is for those drugs that are going to be prescribed by our federally qualified community health centers, we have to make it easier for those patients to acquire these drugs. They have to be distributed to the pharmacies in the area without exclusions. The committee was excited about this bill, and I am too. The committee recommended reporting the bill 5-0 and re-referring it to finance, and I so move.
Second.
Thank you. It's been moved that we report SB 119. And is there any discussion from our committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 119 has been reported and re-referred to finance. Senator Favola.
Thank you, Madam Chair. Senate Bill 140, the patron was Senator Carol Foy, and I move the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. The substitute modifies requirements relating to the fetal and infant mortality review team's criteria for the selection and review of reported fetal and infant deaths in the Commonwealth and the composition of the team's membership. The substitute authorizes the co-chairs of the team to establish fetal and infant mortality advisory panels to make recommendations that may be included in the team's triannual report on items related to fetal and natural infant death, and makes the work of the team contingent on the provision of ongoing funding. The committee heard testimony that Virginia still has a higher than average rate of fetal and infant mortality, and it particularly is prevalent among our moms and children of color, and this is something that we feel we need additional information on. It was the will of the committee to report the bill and re-refer it to finance, and I so move.
Second.
It's been moved and seconded that SB 140 be reported with the substitute and re-referred to finance. Is there any discussion from committee? Seeing none, clerk will open the roll. You need to vote.
Ayes 15, no zero.
Thank you. SB 140 has been reported with substitute and re-referred to finance. Senator Favola.
Thank you, Madam Chair. I refer you to Senate Bill 149. The patron was Senator Suderline. And I guess my first motion would be we recommend incorporating Senate Bill 488 into Senator Aird's. Senator Aird's bill was, I believe, Senator 149, my mistake, and I will explain the bills. Yes, and the incorporation, I think we have to.
There's a motion and a second that we incorporate SB 149 into SB 488. Clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 149 has been incorporated into SB 488, so you are presenting on SB 488 now.
I believe I am. So what we did is it directs the Department of Medical Assistance Services, DMAS, and the Department of Behavioral Health and Developmental Services to seek to modify the program. This is for our 1915 waivers, the home and community-based waivers. What we're looking to do is to eliminate the requirement that in order for a legally responsible individual to receive reimbursement for personal care services, no one else is available to provide those services. This requirement was a bit of a barrier for family members. They had to look around to find somebody else and document. There was nobody else available except them. We're asking DMAS to consider a waiver that would remove that. And also to modify the program rules to allow for respite services when the legally responsible individual is the unpaid caregiver, and modify the program rules to allow a legally responsible individual to be the employer of record. The intent here is to follow a process that DMAS had allowed during COVID. And there are now some federal guardrails that were not in place during COVID, but this waiver is going to try to ask for some relief of those guardrails and yet still keep other guardrails. It is the will of the committee to report this on a 5-0 vote, and it is unclear to me whether I have to send it to finance. I do. Okay. A motion is to report the bill and to re-refer it to finance.
So moved.
Second.
Thank you. It's been moved and seconded that It's been moved and seconded that SB 488 will be reported and re-referred to finance. Now, does committee have any comments?
Great bill.
As substituted. I agree with my colleague who said it's a great bill. I know all of us have heard from families and constituents who see this as such a critical need. I thank Senator Suderline and Senator Aird for bringing this bill together. Both of you are listed as co-chiefs on this bill, so I thank both of you for moving this bill forward. No other comments from committee, so clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 488 is reported with the substitute and re-referred to finance.
Thank you, Madam Chair. I now turn your attention to Senate Bill 186, patron is superamendment. And this had to do with, I'll ask that the substitute be adopted first.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Okay, the substitute that the committee adopted was really an amendment in the nature of a substitute. It changes the directive of the work group that the Secretary of Health and Human Services shall be charged to convene a work group to develop a plan for the implementation of a wholesale prescription drug importation program and to evaluate the feasibility of establishing a wholesale prescription drug importation program. Again, the presentation before the subcommittee evolved around the possibility of receiving drugs at a discounted price, possibly from our neighbor to the north. But it was unclear how to do this or whether it would be incredibly feasible. That's why the work group was established. It was the will of the committee to recommend reporting this and re-refer it to finance, and I so move.
Second.
It's been moved and seconded that SB 186 be reported with the substitute and re-referred to finance. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 186 has been reported with substitute and re-referred to finance. Senator Favola.
Thank you, Madam Chair. I draw your attention to Senate Bill 231. The patron was Senator Hashmi. This is the Comprehensive Children's Health Care Coverage Program, and there was an amendment, and I so moved the amendment.
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposition? The amendment is adopted.
Madam Chair, what this bill does essentially is it creates a health insurance program for individuals who, because of immigration status, are not eligible under federal law to participate in Medicaid. It sets up a separate state-funded health insurance program. And we had very compassionate testimony before the subcommittee. The amendment eliminates the requirement that DMAS convene a work group. What it does is it sends this right to finance. I do want to note that Medicaid would cover, by law, any emergency services that an individual would need who is not currently insured. So it is the will of the committee to report this. It reported out on a 3-2 vote and re-refer it to finance, and I so move.
Second.
It's been moved and seconded that SB 231 be reported with the amendment and re-referred to finance. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 9, no 6.
Thank you. SB 231 has been reported with the amendment and re-referred to finance. Senator Favola.
Thank you, Madam Chair. I now draw your attention to Senate Bill 277, patron Senator Hashmi. This has to do with the Certificate of Public Need and an expedited application and review process. There is a substitute, and I move the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. The substitute changes the bill to a Section 1 bill, and it directs the Board of Health to convene the State Health Services Plan Task Force to develop recommendations on an expedited review of project types subject to Certificate of Public Need requirements, including recommendations on the criteria that should be applied to any such project types, and on a framework for an application and approval process for such projects. This group had been meeting prior to this bill, but it's important that they continue to meet and that they can identify some of the services provided by our hospital systems that could benefit from an expedited review. And actually, the request for psychiatric beds is included under that expedited review process, which is an important note. It was the recommendation of the committee to report this out 5-0, and I so move.
Second.
It's been moved and seconded. It's been moved and seconded that SB 277 be reported with the substitute. Is there any discussion from the committee? Seeing none, clerk will open the roll. Senator Peake.
Ayes 15, no zero.
SB 277 has been reported with the substitute. Senator Peake has filed a request that we slow things down. Senator Lucas has declared no, no, no.
Yes, Madam Chair, if he wants to sit in the committee that's slowed down, tell him to go to Senator Servo's committee.
Senator Peake, your motion has been overruled by Madam Chair. Senator Favola, SB 390.
Thank you, Madam Chair. So now I have my orders. I asked the committee to put your attention on Senate Bill 390. The patron was Senator Pekarsky. And this, there is a substitute, and I move the adoption of the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. So the substitute expands and modifies the bill by establishing the sudden unexpected death in epilepsy review team, and that we do this for the purpose of developing and implementing procedures for the review of such cases to ensure that they are analyzed in a systemic way, and including the development and revising as necessary of operating procedures for the sudden unexpected death in epilepsy reviews, and improve the identification of data and record keeping. In the past, we don't believe that the sudden unexpected death in epilepsy process adequately evaluated or provided detailed information on these cases. And it is important that we get that information. The substitute does require recommendations on how to increase awareness about and prevention of sudden unexpected deaths in epilepsy. And of course, training would also be included. It was the will of the committee to recommend reporting this bill on a 5-0 vote, and I so move.
Second.
It's been moved and seconded that SB 390 be reported with the substitute. Is there any discussion from the committee? Seeing none, clerk will open the roll.
He wants to be in.
Ayes 15, no zero.
SB 390 has been reported with the substitute. Senator Favola.
Thank you, Madam Chair. I ask the committee to put your attention on Senate Bill 579, patron Senator Obenshain. And this had to do with nursing homes and certified nursing facilities, the professional liability insurance that might be needed. The bill specified a required minimum amount of professional liability coverage for nursing homes and certified nursing facilities. And the bill also required coverage to be non-eroding, so it would be continual. The committee, this was sort of a controversial bill for various reasons, and the committee recommended continuing the bill to next year, and that is my motion.
It's been moved and seconded that SB 579 be continued. Is there any discussion from our committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 579 has been continued. And Senator Favola.
Thank you, Madam Chair. This is my last bill on my report. I ask the committee to turn their attention to Senate Bill 610 and the patrons, Senator Suderline and Senator Pekarsky. There is an amendment to this bill, and I so move.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The amendment has been adopted.
The amendment clarifies the scope of the bill and directs DMAS and DBHDS to make their regulations by changing the time frame in which such consecutive slot retention requests. So we're talking about slots for individuals who would be eligible for the developmental disability waiver. And right now, the slot retention is about 6 months maximum. So if you don't get a slot within that period, you're off the list. What this bill does is it allows you to stay, on the list, eligible for a slot for a period of 365 days. It was the will of the committee to report this bill as amended, and I so move.
Second.
It's been moved and seconded that SB 610 be reported with amendment. Is there any discussion from our committee? Is there any commendation for Senator Suterline for bringing another good bill? And bipartisan. Seeing no discussion, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 610, patroned by Senator Suterline and Pekarsky, has been reported with amendment. And that is your final bill, Senator?
Yes, Madam Chair, that completes my report.
Thank you for your report. And our final report comes from our Public Education Subcommittee, and that is chaired by Senator Van Valkenburg.
All right. Thank you, Madam Chair. Now we get to the majority of the docket. All right. So let's start with Senate Bill 72, and first I need to move the substitute.
So move. A second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
All right. Senate Bill 72 is about creating a Virginia Parent Data Portal. This comes out of a bill from last year that created a working group to create this portal. The substitute modifies the provisions related to the creation of it by saying that it can be created in a manner that leverages existing school division user management and is compatible with their systems, also clarifies some of the content that goes on there, establishes an advisory committee for the portal, and modifies the requirements for professional development for teachers, principals, and other school personnel relating to parental support and engagement in using the portal. We recommended reporting the substitute and re-referring to finance on a vote of 5-0, and I so move.
Second.
It's been moved and seconded that we report SB 72 with the substitute and re-refer to finance. Is there any discussion from our committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 72 has been reported with substitute and re-referred to finance. Senator Van Valkenburg.
All right, Madam Chair, next is Senate Bill 199. Let's move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
All right, so the substitute is different than the regular bill, so everybody should have looked at the substitute. The substitute modifies the required contents of the list of industry-recognized workforce credentials that the board is required to develop and maintain by eliminating the requirement that include workforce credentials that a student may take as a substitute specifically for required credits in a lab science. It limits it to including such workforce credentials that a student may take as an elective. It adds language clarifying that the list is required to include industry-recognized workforce credentials completed outside of regular school hours. That's the important piece to this bill. The committee recommended reporting the substitute on a 5-0 vote, and I so move.
Second.
It's been moved and seconded that SB 199 be reported as substituted. And yes, committee, any questions from the committee?
Thank you. So my question is, the contents of industry-recognized workforce credentials, this would be optional on the school systems to adopt this if they want to offer this opportunity to their students? Is my question.
Let me pull it up.
I'm sorry.
All right. Give me 1 second, Madam Chair. I'm just
Take your time.
pulling it up. It's loading, and I just got it up.
Senator Favola, is this a question that we might need the patron?
Or general
So,
counsel.
Madam Chair, I think the answer to can you repeat the question, actually?
If it's optional.
If it's optional.
It is optional.
It is.
Okay, I just wanted to clarify that.
Yeah, counsel.
Council will clarify.
So what the bill, as amended by the substitute, does is it requires the Board of Education to establish and maintain that list, of industry-recognized workforce credentials that students may take as a substitute for certain required graduation credits. And then also, if you look in lines 251 through 252 of the substitute, it also requires each school board to accept any credential that's on that list maintained by the board as a substitute for a required credit, if a student chooses to elect to do so. So it's not permissive.
Right. Well, yeah, Madam Chair, what I would say, yeah, to build off what Council just said, what this is saying is the real core of the bill is that you would have a student who would take a workforce credit in school and it would be able to be flipped out, and then you would have a kid who would do the same class out of school and couldn't get credit for what was ostensibly the same thing. And this is trying to tighten that up to say, hey, if you do that workforce credential outside of the classroom, you can get credit, and then the guardrail it puts is it's got to be from this list. But then it does say that the school has to accept it. Yeah. Does that make sense?
Senator Favola.
Madam Chair, that answers my question, because this really only comes into play if the school has a curriculum that
Yes.
And I think that's what the point was. Thank you.
Senator Van Valkenburg, did VCCS have any comments during public testimony?
I do not remember them, Madam Chair, I do not remember them speaking during this bill.
Okay. It's been moved and seconded that we report SB 199 with the substitute, and this is not going to finance, am I correct? So is there any further discussion? Senator Favola, your name is in the queue, but is that? Okay. Seeing no further discussion, clerk will open the roll.
Ayes 15, no zero.
SB 199 has been reported with the substitute, and Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 225. This requires each local school board to develop and implement a policy to require the annual notification of the parent of each student enrolled in the local school division to be sent by email or text message within 30 calendar days succeeding the first day of the school year, of the parent's legal responsibility to safely store any firearm present in the household, risks associated with improperly stored firearms, statistics relating to firearm-related incidents, injuries, and death among youth, and other tips and strategies. This bill requires each school board to make such parental notification available in multiple languages on its website. The subcommittee recommended reporting on a vote of 3-2, and I so move.
Second.
It's been moved and seconded that we report SB 225. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 9, no 6.
Thank you. SB 225 has been reported. And Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 227. This is the first of 3 or 4 bills that relate to the JLARC report and the kind of bridge in funding of, we want to move to a new funding formula, but in the meantime, we want to make the one we have more robust. And so Senate Bill 227 is one of these bills, and this is the one, let me make sure I'm getting this right.
There is a substitute.
This is and there's substitutes. Yeah, let's move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitutes in front of us.
And this is the omnibus one, right? This is the omnibus one. This includes all of the recommendations to kind of make our current system more robust. After this one, we'll be voting on a couple that are specific provisions within this. So I'm going to give much shorter summaries of those ones, because if you vote for this one, there is no reason why you would not vote for the other ones, because they're the same thing. All right. So the subcommittee recommended reporting the substitute and re-referring to finance on a vote of 4-1, and I so move.
Thank you. It's been moved and seconded that SB 227 be reported with substitute, re-referred to finance. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 227 has been reported with substitute and re-referred to finance. Senator Van Valkenburg.
Next up, Madam Chair, Senate Bill 228. I move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
This is one of those bills. You should vote for it. It's a small part of the omnibus bill. We recommended reporting the substitute and re-referring to finance on a vote of 4-1, and I so move.
It's been moved and seconded that we report SB 228 with substitute and re-refer to finance. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 228 has been reported with the substitute and re-referred to finance. Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 264. I'd like to move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
Thank you, Madam Chair. This is about transparency around when schools are using data collection on devices that they issue. So, think laptops that are provided to students. The substitute reduces the scope of the bill. We took some parts out. We tweaked some language. It adds language specifying that the requirements relating to student online activity data collection are applicable only to a school board for which a school within the school division it governs collects student online activity data, and eliminates certain provisions relating to obtaining consent from parents to monitor, track, or collect data on student activity when using school or personal devices on student property, setting certain age limits on student online access, and permitting parents to waive certain limits. The substitute also adds requirements, including a requirement for the school board to include in the school division's acceptable use policy that student online activity is being tracked and associated data collected. If I can boil that down into English, basically what this bill does now is provide transparency around when schools are collecting metadata through devices that they have issued and alerts families and students to the fact that they are doing that. And that is the core of the substitute. The subcommittee recommended reporting the substitute on a vote of 5-0, and I so move.
Second.
It's been moved and seconded that SB 264 be reported as substitute. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 264 reports with the substitute. Senator Van Valkenburg.
Thank you, Madam Chair. Next up is your Senate Bill 272, which relates to English language learners. It requires state funding to be provided pursuant to the General Appropriation Act to support division-wide ratios of English language learner students with certain ratios. So for each English language learner identified as proficiency level 1 for every 25 students, one position every 25 students. For those at level 2, one position for every 30 students. For proficiency level 3, one position for every 40. And for everybody else, one position for every 50. Current law requires state funding to be provided for one position per 50 English language learners, regardless of the level. I will just add an amen to this. I mean, we have over 120 languages in Henrico County and climbing. When I started in this gig 7 years ago, we were at 75, 80. This is a huge need. And so we recommended reporting and re-referring to finance on a vote of 5-0, and I so move.
Senator Favola.
Thank you. I just want to be clear. This would become a standard of quality if we were to adopt this.
Senator Favola, yes.
Essentially, it looks like it's a standard of quality. Okay, yes. So I just think that needs to be noted because in many respects, our school systems are not receiving enough money from the state to meet the current standards of quality. I can see why this would be going to finance. And my other question, and my apologies, I don't have the bill in front of me, when would this take effect?
I believe it takes.
I'll defer to the chairwoman, but I'm pretty sure it's right away.
Yes, I believe it takes effect as soon as it's been,
So
for the
then it
next
would be-
academic school year.
It would be in effect for the next academic
Yes.
year, the
Next academic
24-25 school year.
That's right.
Okay.
It's been moved and seconded that SB 272 be reported and re-referred to finance. Is there any further discussion on the bill? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 272 has been reported and re-referred to finance. Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 379, which has a substitute, so I'll move the substitute.
Is there a second? Is there a second?
Second.
It's been moved and seconded that we adopt the substitute. All in favor? Aye. Any opposition? Substitute is in front of us.
Thank you, Madam Chair. This bill is about research-based hazing prevention instruction for 9th and 10th graders. The substitute eliminates the provision requiring each school board to develop a program of research-based hazing prevention instruction, and instead requires the Board of Education to develop standards of learning and curriculum guidelines for this instruction to be provided as part of physical or health education instruction provided to students in grades 9 and 10. It also provides a provision requiring each school board to begin providing such instruction the school year following the board's adoption of this. One thing I do want to put a pin in, and this might be for the floor, but one of the conversations was around high school versus middle school, and I think the preferred thing would be for it to be in middle school. And I think I talked to a bunch of people, a lot of people agreed with it. I'm not going to say that we make this amendment now because the good senator's not here, and while she's interested in it, I would like to confirm that, and I think it's an easy fix that we could do later. I just want to put that in everyone's mind's eye. But the bill did pass, we did recommend reporting the substitute on a 5-0 vote, and so I move.
It's been moved and seconded that SB 379 be reported with the substitute and with the substitute, but not going to finance. Am I correct? Yeah. With the understanding that there may be some further amendments offered by the patron or others. Is there any other discussion from the committee? A clerk will open the roll. Senator Aird.
Ayes 15, no zero.
Thank you. SB 379 has been reported with the substitute. And Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 387, which we recommended incorporating into Senate Bill 726 on a vote of 5-0. And so I move that we incorporate Senate Bill 387 into Senate Bill 726.
It's been moved and seconded that SB 387 be incorporated into SB 726. Clerk will open the roll.
Who's got Boy Scout?
Ayes 15, no zero.
Thank you. SB 387 has been incorporated into SB 726, so SB 726 is now in front of us.
All right, Madam Chair, members of the committee, Senate Bill 726. This is around school policies around naloxone procurement, possession, and administration, and around employee training and certification. The substitute retains the requirement unique to Senate Bill 726 relating to instruction on opioid overdose prevention and reversal for students. It incorporates the provision from 387 relating to immunity for public school employees from civil and criminal liability and disciplinary action for any act or omission arising from the good faith administration of an opioid antagonist, and standardizes all references throughout the bill from naloxone to opioid antagonist. The substitute also incorporates provisions requiring the school employee training required pursuant to the bill be provided through training programs administered or approved by the Department of Health. It requires each school board to utilize to the fullest extent possible programs offered by the Department of Health for the procurement of opioid antagonists for placement in public schools. We recommended reporting the substitute on a 5-0 vote, and I so move.
It's been moved and seconded that SB 726 be reported with the substitute. Is there any other discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 726 has been reported with the substitute.
All right, Madam Chair, members of the committee, we got to do two things here to get this bill in the right posture before we do Senate Bill 395 on policy. First is we need to adopt the substitute. I move the adoption of the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? Substitute is in front of us.
And then next, we have an amendment for the committee to consider, and I will defer to council to read and or pass out.
Move the amendment.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposition? The amendment has been adopted, and council will share the amendment.
Thank you, Madam Chair. The amendment to SB 395, the substitute, it includes a provision permitting parents to, upon written request, exempt his child from the provision that requires a signed report attesting that the student has received the mental health assessment in order to be deemed eligible to participate on interscholastic athletic teams, provided that such student still receives the required physical examination and submits the required signed report.
All right. It does kind of two things. One is it extends the amount of time you have to get a physical for sports participation, but the kind of main gist of the bill is that when you get that physical, you will also get a mental health check. This is the kind of quick questions they ask you at your yearly checkup. This is done anyway in most pediatrician checkups, and so this is just trying to capture kids who might not get that yearly pediatrician checkup, but they get the physical checkup. It's kind of, as was testified on during the subcommittee hearing, this is kind of standard procedure anytime you're going before, not just your kind of primary care physician, but a lot of other physicians as well. Yeah, I think that's about it. So we would recommend reporting the substitute. We recommended reporting the substitute on a 3-1 vote. So the recommendation would be to report the substitute as amended, and I so move.
Second.
It's been moved and seconded that SB 395 be reported as with the substitute as amended. And is there any discussion from committee? Senator Suderline.
Thank you, Madam Chair. I think that Senator Van Valkenburg's description of what happens at so many of our children's physicals now is completely in line with the experience of my several children's going through them. But what's also in this bill, which seems to be a departure from the policy that the Commonwealth has had for some time, and usually Republicans want us to intervene sometimes and Democrats want us to intervene other times, but we just don't, is the paragraph C regarding the interscholastic organizations, and that we're going to be requiring them to require this.
Is there a question?
Madam, is that a question?
It's just a statement.
Senator Pekarsky.
Sorry, yeah, thank you. So we did work with the VHSL. They have no issues with this, and it's not really requiring them as much as it is a requirement of the practitioner who is providing that sports physical, and it will have absolutely no impact on whether a child can participate in sports. This is really, as the senator said, an opportunity to capture children that, for whatever reason, are not going to these yearly checkups to pediatricians who already have this as standard of care. They may be going to urgent care. They may be doing a mass physicals clinic in their high school or CVS or whatever to pick up any red flags. It's not a full evaluation. It's a quick screener. So, we added the provision where parents can opt out to try to be, work with people for whatever reason they don't want that. But there has not been any opposition by VHSL. So.
Thank you, Senator Prakarsky. Senator Suderline, do you have additional comment?
Yes, Madam Chair. I understand that, but I'm just pointing out that this is a departure from where we've gone. And one of the things that we relied on for a long time was not doing this. And so I expect that once we've crossed it, as is often the case, we cross a bridge on something easy, but then we will continue to do so. So I just wanted to make note of that.
Thank you, Suderline. Are there any other comments from the committee? Seeing none, was there a motion, Senator Van Valkenburg? I believe we had a motion and a second to report with the substitute SB 395. Does council want to clarify?
Yes.
I'll ask the question I asked council. How about that, Madam Chair?
Please. Thank you, Senator Van Valkenburg.
Madam Chair, I asked council if physicals for athletics and for schools was in the code or in VHSL regulations.
And council will respond.
Thank you, Madam Chair. Yes, and I responded that it is required by law, as we see in the existing language of the statute that's amended in front of us. Additionally, the VHSL regulations mirror that law. And then I also pointed out to Senator Van Valkenburg that the language pertaining to shall become a member of any organization or entity whose purpose it is to regulate or govern, ... is language that is also utilized in an existing section of the code, 22.1-5.1, that is similarly structuring requirements relating to interscholastic participation by students in military families, and that provides that no public elementary or secondary school shall become a member of any organization or entity whose purpose it is it to regulate or govern interscholastic programs that does not deem eligible for participation a student who, and then lists a series of eligibility criteria. So that language does exist in current law and wouldn't be a complete deviation from current requirements.
Thank you to council, and we have Senator Favola in queue.
Just a question. My understanding is that this would have to happen every year if the child was going to continue to participate in sports. Is that correct?
Senator Prakarsky.
Yeah, Madam Chair, Senator, yes, students who want to participate in sports have to get a yearly physical. So this would be part of it. And as I mentioned earlier, this is already part of the standard of care in yearly checkups. It is not a full psychiatric evaluation. It is a screener. So.
Thank you, Senator Prakarsky. Senator Favola, does that answer your question?
One other question. My understanding is a school nurse could actually do this. If you said you signed a report from a licensed physician, licensed advanced practice nurse, registered nurse, licensed physician assistant. So if the school nurse happened to meet one of these requirements, the child could get that screening. I don't want to establish a barrier for children who really don't have access to a medical exam every year.
No, thank you, Madam Chair. Senator, yes, anyone who is has the ability to perform these sports physicals, can also do these mental health screeners, and that information, there are screeners already as part of standard of care. They have 2, 3, 5 questions. It's very simple. As the senator said, most of us who have young children have seen these, and that information will only be given to parents.
Senator Favola.
Thank you, Madam Chair. My questions have been answered.
Next in queue is Senator Durant.
Thank you, Madam Chair. A question for the patron.
Please go ahead, Senator.
Thank you, Madam Chair. Senator, I was just wondering if there were, in a part of that screening with the mental health, if there was any type of triggers, that or flags that were raised. What's the protocol then? Are there certain types of scenarios or flags that would be risen that could preclude that child from participating? In other words, could they fail that portion of the screening that would deem them ineligible to participate?
Senator Pekarsky.
Yeah, sure. Thank you. Oh, Madam Chair, I'm sorry. I'm so excited to answer the question. No, I don't believe so, unless, and I'm not a doctor, I'm not a practitioner. I think this is better answered by one, and we do have somebody that maybe, I don't know if it's okay with Madam Chair.
Madam Chair, maybe I don't know if that's a question for council or if somebody can, are there scenarios where this could potentially?
I will just say, Madam Chair, as I understand it, it is not any different than if a child goes to their pediatrician, their yearly checkup, and perhaps a child presents as suicidal or harm to themselves, an immediate harm to themselves, and then that practitioner has an ethical obligation to step in and, provide whatever next standard of care would be. But unless there are immediate threats for some reason where that child needs to be provided care, this will have no impact. This will not be information that goes to the school in any way, shape, or form. It is for the parents' purposes to do as they see necessary.
Madam Chair, follow up.
And if I may ask council to clarify that point before we address.
Thank you, Madam Chair. So this is just to clarify the provisions of this bill as written. Eligibility for participation in these interscholastic athletics is only contingent on the submission of the signed report saying that the student has received both the physical and mental health examination. And if you look in line 19, it just says found to be physically fit. So there wasn't an amendment added to say physically and mentally fit. So for the purposes of this bill, the results of the mental examination are essentially they're not referenced at all in the bill as relevant towards the determination of eligibility. It's simply the submission of the signed report saying that the mental health assessment happened. And it sort of leaves open, I guess, for the school or for the physician, whatever information relating to the mental health screening might indicate about the student's needs, but that has no bearing on the eligibility for athletic participation.
Thank you, council. I believe Senator Durant has additional point, then Senator Peake, and then Senator Favola.
Yeah, Madam Chair, just speaking to the bill, my concerns are, and I'm 100% on board in tackling children's mental health. My concerns are that if there is this element that's added to it, that could preclude children from disclosing if they've got it in this manner, if they're afraid that they may not be able to participate. And we're creating some scenarios where children, where they actually need it in part of their mental health to be able to participate and continue with their activities, and may not want to disclose where they need to. It's hard for me to outline part of those, but I have concerns about children feeling that they if they do disclose some of that, they're not going to be able to continue with their friends and moving forward with what might be part of their maintaining their health. Thank you, Madam Chair.
Thank you, Senator. And Senator Peake.
Thank you, Madam Chair. And I guess a comment for the patron. And I don't really have any objection at all as asking the students if they have dangerous thoughts for themselves or others. I think the question I have right now is it just says mental health assessment. And so what I'm hearing from some constituents is we're afraid that what may be contained in mental health assessment may go into more issues other than harm to self or others or suicidal thoughts, which I think are appropriate questions, but I think some are concerned that they'll start getting into other issues. And so if there's any way we could tighten that up of what mental health assessment looks like, I'd be more comfortable. Thank you, Madam Chair.
Thank you. Thank you, and I'll ask Senator Pekarsky to respond.
Thank you. I am happy to pass this by for the week to try to get some tighter language to address that, because it is absolutely not the intention of the bill. And as you heard, in subcommittee, that these are screeners. They already exist. They're part of standard care. They're very short. They're not full. So I'm happy to work with folks. I see Senator Favola making faces at me, so she may want to say something. But
I have Senator Favola, then Senator Van Valkenburg, and Senator Aird in that order in queue. So Senator Favola.
Thank you, Madam Chair. I will just say from the discussion I'm hearing, what is being proposed is already established as good practice for pediatricians and others. The American Academy of Pediatrics, the Virginia chapter of pediatrics actually has a practice protocol that talks about asking certain mental health questions, and insurance, especially your capitated rate insurance plans, which is sort of a complicated thing, they're setting out incentives. I just got a law through Commerce and Labor where a full mental health screening will be part of any visit to your primary care physician. So I'm wondering if this is even needed given where practice is going. With all due respect, I think you should maybe talk to some of the healthcare associations and see what they have to say. I think this is already addressed in current practice.
Thank you, Senator. Thank you, Senator Favola, then Senator Van Valkenburg.
Thank you, Madam Chair. Madam Chair, members of the committee, I think we're getting a little bent around the axle on this, and I got to say, I'm not really a thoughts and feelings kind of guy. I like to shove it down and just not talk about my thoughts and feelings, right? But
really,
however,
my goodness,
however, the reason I bring this up is all I hear about, and I think rightfully, and it's a governor's priority, it's I think a legislative priority, is we need to focus on mental health and behavioral health. And I would suggest that we can spend a lot of money on mental health and behavioral health, but if we don't know who needs the help, what use is the dollars? And what we're having right now is a conversation about a very simple bill that doesn't, with all due respect to Senator Favola, doesn't cover everybody, because there are kids who do not get yearly checkups. That is a fact. And there are kids that don't get yearly checkups that still can get a physical through the school or through an organization to help them play sports. And so this is covering a gap. And we can take the bill by and workshop the ideas. I'm not saying I oppose that. I'm just simply stating I would like us to all sit with the fact that we're spending a lot of time as a legislature and as a government talking about mental health and behavioral health, but we have to be able to identify people, and these screeners are a simple way to try. That's all I'm saying, is that we should think about that when we're having this conversation.
Thank you, Senator Van Valkenburg. Senator Aird.
Madam Chair, thank you. I want to thank Senator Pekarsky for the bill, and I think what she hears up here is everyone is committed to tackling the mental health challenges that we as a society are facing, particularly our young people. I think I would second some of the comments that came from Senator Favola, because I feel actually that we've contradicted ourselves in debating this legislation in particular. On one hand, I have heard that this bill is about ensuring eligibility to participate in a sport, but then when clarified, it's not about eligibility, it's just a screening. So the legislation is not clear and disingenuous in that way. I also feel like we do already do these physicals. I have 2 boys, they do these physicals every year. And so actually the right place for this to live is not just during a physical where you're talking about, can you jump? Can you bend over? I'll sit through the physicals every year. And if we're gonna do mental health screenings, they do need to be with a primary care physician that is doing a thorough assessment. So as a parent, it's not conflated with your physical state solely, but I can walk away if there's a mental issue in making a separate plan of action. And so I ask that as you continue to look at the right language and look at what next steps are, that you certainly clear whether or not this is about eligibility or not, because I do think that can be conflated if we move forward with this. Thank you, Madam Chair.
Thank you. Senator Pekarsky, you have agreed to carry this by for the week and continue to work on the legislation. If there are no other additional comments, then we will accept that. Thank you. So Senator Van Valkenburg, let's continue with the docket, and that is SB 443.
All right.
Simple bill.
Simple bill. Simple bill. Senate Bill 443 requires the superintendent of any school division to, upon receiving notification of the disposition in a delinquency case concerning a student who is not enrolled in such school division, forward such notification to the superintendent of the school division where such student is enrolled or where such student intends to enroll, as evidenced by the receipt of a request from the other school division for each student's scholastic records. Current law only permits the superintendent of any such school division to forward such notification to the superintendent of the school division in which the student is currently enrolled. The bill also requires a copy of the complete student disciplinary records of any student transferring from one school division to another to be transferred to the school division to which such student is transferring upon request from such school division. I think to break this down, a student is in jurisdiction A, they move to jurisdiction B. When the student transcript goes from jurisdiction A to jurisdiction B, they would have to also notify them about the disposition in a delinquency case or their records thereof. And so we had a pretty robust conversation about this. We did recommend reporting it on a vote of 3-2. I guess I'll make that motion and then let you open it up, Madam Chair.
I second the motion.
Thank you. It's been moved and seconded that SB 443 be reported. Are there any other discussions from committee members? Clerk will open the roll.
Ayes 13, noes 2.
SB 443 has been reported. And your next bill, Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 445, and first we need to move the amendment.
So moved.
It's been moved and is there a second?
Second.
It's been moved and seconded that the amendment be adopted. All in favor?
Aye.
Any opposition? The amendment has been adopted.
Thank you, Madam Chair, members of the committee. The original bill required each local school board to give any veteran or active member duty of the armed forces who employs a teacher credit for any time served in the armed forces as part of their pay. The amendment made it permissive for the localities to do that. So you've been in the armed forces 10 years, you come to teach in locality A, you have to give that 10 years towards part of their pay scale. It went from being basically a shall to a may. We recommended reporting with amendment and re-referring to finance on a vote of 5-0, and I so move.
Second. It's been moved and seconded that SB 445 be reported with amendment and re-referred to finance. Is there any further discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 445 has been reported with amendment and re-referred to finance. Senator Van Valkenburg.
Next up is Senate Bill 474, and Council has an amendment, so I will let's move the amendment. I move the amendment.
Second. It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Aye. Any opposition? The amendment has been adopted. Can Council explain the amendment?
Yes, Madam Chair, the amendment makes 2 changes to in the form of a substitute. The first being that it ensures that joint or regional schools are included in the Virginia Public School Construction Grants Program. So this also includes regional public charter schools and academic year governor schools. And then it also strikes language referencing criteria established by the 2000 session of the General Assembly because that criteria was never actually established. And instead, it inserts board as in Board of Education to direct the Board of Education to establish that criteria. And that mirrors provisions authorizing the board to establish similar criteria in the Public Educational Technology Grants Program.
And Madam Chair, members of the committee, what this bill does is it says that the Board of Education needs to revise its guidelines on the Virginia Public School Construction Grant Program, because what that grant program currently does is allow you to get a grant for a single locality for a building within that locality. However, there's oftentimes regional schools where multiple localities come together for some purpose, right? And they can't access the fund. And so this bill is to clarify that those kind of regional schools, which can also be old or need help, right, can access this grant. And so the amendment kind of cleans it up to make sure they're not excluding any of the regional schools, as council noted. And so we recommended reporting and re-referring to finance on a vote of 4-0. And so the recommendation now would be to report as substituted, recommend reporting the substitute and re-referring to finance, and I so move.
Second.
It's been moved and seconded that SB 474 be reported as substituted and re-referred to finance. Is there any further discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 474 has been reported with the substitute and re-referred to finance. Senator Van Valkenburg.
Thank you, Madam Chair. Members of the committee, next up is Senate Bill 484. This establishes a community builders pilot program and fund in Roanoke City and Petersburg City for the purpose of reducing youth involvement in behaviors that lead to gun violence and increasing community engagement among public school students by providing to students who are entering the 8th grade in those two localities opportunities during the school year after regular school hours and during the summer months for community engagement, workforce development, post-secondary education exploration, and social emotional education and development. We recommended reporting and re-referring to finance on a 5-0 vote, and I so move.
Is there a second?
Second.
It's been moved and seconded that SB 484 be reported and let me make, it's been moved that SB 484 be reported and re-referred to finance. Does committee have any comments? And Senator Suderline.
Thank you, Madam Chair. Just briefly, it was well explained. I just wanted to alert the committee to the presence. We have about 24 students from William Fleming High School. So if we're able to pass this program, perhaps some of their classmates or younger siblings could benefit from this in the future.
Thank you, Senator Suderline, for that recognition of our welcome guest today. And are there any additional comments from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 484 has been reported and, was there a substitute? No. Has been reported and re-referred to finance. Thank you. And Senator Van Valkenburg, your next bill.
Thank you, Madam Chair. That's one of the few that got out without a substitute. This one does have a substitute, so I move the substitute for Senate Bill 498.
Second.
It's been moved and seconded that we adopt the substitute. All in favor? Any opposition? Substitute is in front of us.
All right, so Senate Bill 498 is about notifying parents when there has been a drug overdose. The amendment in the nature of a substitute incorporates amendments that we adopted in the subcommittee during our conversation that increase protections of student privacy and personal information when issuing notifications of any school-connected overdose. by adding language expressly limiting the requirement that such notifications include information on the circumstances surrounding the overdose to only that information not prohibited by any applicable law, rule, or regulation relating to the disclosure and protection of a minor's personal, confidential, and otherwise sensitive information. Basically, this bill would say that school systems have to send out a notice to parents within 24 hours if there's been an overdose that's during the school day related to a school activity. The conversation that we had in subcommittee was around the language feeling a little broad in what they had to report. And so the substitute was trying to narrow that a little bit to make sure that we were getting parents information that was pertinent and that they would want to know without it kind of getting into people's privacy, without it kind of over-explaining. And so we accepted that substitute, and we recommended reporting with substitute on a 5-0 vote, and I so move.
Second. It's been moved and seconded that SB 498 be reported with the substitute. Are there any other discussion from the committee? Clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 498 has been reported with the substitute. And Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 518. This requires each school board to employ at least one college and career specialist as defined in the bill in each public high school in each division. It provides that such individuals shall be employed in addition to and not as a replacement for required school counselor positions. And so this is just kind of another way of trying to get at the idea of the support staff that can help students, in this case, as it relates to college and careers. We recommended reporting and re-referring to finance on a 4-0 to 1 abstention vote, and I so move.
Thank you. It's been moved and seconded that SB 518 be reported and re-referred to finance, and I see Senator Suderline would like to ask a question.
Yes, Madam Chair. It appears that this is an unfunded mandate on our school divisions, not unlike the proposal that was brought forward 2 years ago requiring a student resource officer in every school, and another proposal brought forward that would require a registered nurse in every school. And am I mistaken in thinking that?
Senator Van Valkenburg.
Thank you, Madam Chair. He is not incorrect in how he interprets the law.
All right. Briefly, Madam Chair.
Senator Suderline, please go ahead.
Thank you, Madam Chair. I think these folks are great. I think that registered nurses are great. I think state resource officers are great. But I didn't support the other legislation because it was an unfunded mandate on our schools. And having represented some schools that had challenging hiring folks frequently and they're not able to hire everyone that they'd like to right now, I just don't think I can put an unfunded mandate on them. So thank you, Madam Chair.
Thank you, Senator Suderline. Senator Van Valkenburg, did any representatives from school board offer any response to this legislation?
Madam Chair, this was actually, I think, our quickest bill on the docket, but that might have just been that we had so many bills on the docket, as you're seeing now. So we did not have much testimony on this bill that I remember.
Senator Favola.
Thank you, Madam Chair. Speaking to the bill, I think this is just another way of getting to the policy that we have adopted where we're trying to reduce the number of students and the counselor ratio. In other words, we want more counselors for our students, and we want the counselors to spend time actually to pick up on Senator Van Valkenburg's point, to actually assess whether our students are struggling from mental health issues and trying to get them into treatment if that's required. So if you relieve the counselors of their responsibilities to provide, the academic counseling or the college prep counseling that they need to do, and you hire somebody specialized to do that, in effect, you're making it easier for folks who are licensed counselors or psychologists or licensed social workers to actually spend more time with the students and doing the mental health work that we have identified as a priority. So I'm going to go ahead and I think I'm going to vote for this, but it would be an unfunded mandate at this point. I mean, that's the issue, is whether we tell school boards exactly what they're going to do with their funding. Thank you.
Thank you, Senator Favola. Senator Durant, and then Senator Craig.
Madam Chair, thank you. My question's been answered.
Thank you, Senator Craig.
Yes.
Madam Chair, that was one of my. That was my very question. This is an unfunded mandate, and I think I abstained on this bill, if I remember correctly. I wouldn't mind a may, but a shall. We're saying that these schools have to hire these people. If we'll give them the funding, I can support it. Thank you.
Thank you. Are there any other comments from committee? Thank you. Can you renew your motion?
Yes, Madam Chair, I move that we recommend reporting and re-referring to finance, Senate Bill 518.
Thank you. It's been moved and seconded that SB 518 be reported and re-referred to finance. And I'll just add that I share the concerns as expressed by my colleagues around the unfunded mandate. Clerk will open the roll.
Ayes 7, noes 7, 1 abstention.
What does that mean, Clerk?
Fails to report. Fails to report.
Did you want me to explain my abstention, or you were just asking the clerk what that means for the status?
All right.
SB 518 fails to report. Am I correct in that?
All right, next up, Madam
Thank you,
Chair.
Senator Van Valkenburg.
Senate Bill 608. All right, so this requires the Department of Education to create an Office of Community Schools as an office within the department, and the idea is that this will then be able to support the development and growth of community schools throughout the Commonwealth in accordance with the Virginia Community School Framework, and it requires that office to do a bunch of things. The bill also establishes a state goal of prioritizing funding for these initiatives and grant programs to enable their expansion to serve the top 33% of public elementary and secondary schools in the Commonwealth for highest identified student percentage based on data from the preceding year. To boil that all down, this is trying to create an office that will help us grow our community schools. We recommended reporting and re-referring to finance on a vote of 5-0, and I so move.
I'm sorry.
Could you recognize me?
Senator Favola.
Thank you. Before we get into the next conversation, I think some of us would like to reconsider the vote by which Senate Bill 518 failed, and I am going to offer an amendment.
Second. Senator Favola, thank you for that.
Are you on
We
the
have
prevailing
placed
side?
a request. If I could just clarify, we've placed a request for Senator Williams-Grave the opportunity to come and address the committee as well. So let's finish up the bill in front of us and give Senator Williams-Grave an opportunity. As we said at the start of the committee, should any bill run into issues, we will invite the patron to come and address the committee. So Senator Van Valkenburg, if you will finish up on SB 608.
I move that we recommend reporting and referring to finance. I so move.
Is there a second on 608? Second. It's been moved and seconded that we report SB 608 and re-refer to finance. Is there any discussion from the committee on 608? Clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 608 has been reported and re-referred to finance. Senator Van Valkenburg, SB 609.
All right, Madam Chair, members of the Senate, 609 is another one of the bills you've already voted for. So I recommend that we report and refer it to Finance.
Is there a second? SB 609 has been recommended for reporting and re-refer to Finance. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 609 has been recommended for reporting and re-refer to Finance. And SB 624, Senator Van Valkenburg.
Thank you, Madam Chair. This is the last one, certainly not the least. Senate Bill 624 clarifies a couple provisions of the Virginia Literacy Act that we enacted over the last couple years. One, it clarifies the term evidence-based literacy instruction does not include practices that instruct students to gain meaning from print through the use of 3-cueing, meaning structure and visual cues, visual memory for word recognition. Secondly, it removes the option to use a literacy screener approved by the Department of Education for certain purposes that are enumerated in the Act. 3, it requires the department to develop a list of core literacy curricula for students in kindergarten through the grade of 5 and supplemental instruction practices and programs and intervention programs for students in kindergarten through 8. 4, it requires each division-wide literacy plan to address how the local school board will align core reading and literacy curriculum, screening, supplemental instruction, interventions for students in kindergarten through 8. Essentially, this is a cleanup bill. It's kind of going back and it's looking through the stuff as we've started to implement the Literacy Act. And so this is kind of cleaning up some of the stuff we need to clean up. And we recommended reporting it 3-0. That's not because everybody didn't support it. It's just because it was the first bill we wanted to get Madam Chair on her way to Senate Finance. And so I recommend reporting.
It's been moved and seconded that SB 624 be reported. If there is no other discussion from the committee, clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 624 has been reported, and I know that I don't see our patron for SB 518. If we could pass it by for the week.
Such a motion.
But one qualifier that this is, if it passes, it should go to Finance. That is correct. And will there be enough time if we do it next week? Okay. I would move that, what is the motion?
Madam Chair, having voted on the prevailing side by which we failed to report the bill whose number I can't remember off the top of my head, I move that we reconsider that vote.
Perfectly stated. Thank you. It's been moved and seconded that we reconsider the vote. All in favor? Clerk will. Is that a roll call?
Okay. Ayes 15, no zero.
Thank you. We will reconsider SB 518 next week. It will be on our docket again. Thank you to my colleagues for their consideration of the patron on this. With that, I think we are adjourned.
The Senate of Virginia, Richmond, Virginia.